O'Neill.
All right, we have Curtis here. One of our patients with some lower back pain, lumbar stenosis, pain started shooting down the back of his legs. We had done some previous steroid epidurals in the past, which gave him some shorter term relief, and then we actually went to the next step of doing PRP in the epidural space at L4-5, went interlaminar and really covered the whole area. So I'd love for you to, Curtis, to describe the PRP epidural versus steroid epidurals. What do you think, how they reacted differently for you?
Well, when we first did the steroids, it was temporary. I got it, I think that day, in probably a few weeks, maybe a month, I was feeling better. But I still was symptomatic with still some pain going down the leg. So it was like a 20-30% relief. Mm-hmm. And we went to the PRP immediately. I mean, within a week or two, I started having no symptoms. I had no pain going down my legs. I had no numbness going down my legs. As you know, before I came into you, I was having spasms all the time. Yeah. No matter what kind of move I did, I would be scared to do it because I was worried that it was going to cause me to have a spasm and then I couldn't walk. And that's when I came to you and I said, like, I need your help, man.
Yeah.
Please.
And I think he's like a lot of patients that we have out there, right? Has a daughter, plays soccer, he loves playing soccer with her, plays softball as well still, and you're starting not to be able to do those things. Are you able to do those things now?
I am able to do almost everything that I want to do in my life now with no symptoms, nothing going down my legs. I would usually have to squat down when I had pain going down my legs, or my foot would go numb. I would literally have to squat down, stop walking to relieve the pressure off of my disc, and then I would be able to get back up and start walking. But I would do those. I would be walking with my kid, and the next thing my kid's like, "Daddy, you're back," and I'm like, "Yeah," and I'm squatting down. And I haven't, since we done my epidural 6 months ago, I have not had to stop. I have not had to squat down and take the pressure off my back. I have washed my truck, which at times I was worried about that because that one position, if I got to there, I was like, oh my gosh, don't spaz. And there was times it would spaz out on me that I'm like, oh my gosh. And then I was symptomatic for 3, 4, 5 days, and where I couldn't walk, I'm barely being able to move. I washed my truck this past weekend. In my back of my mind, I was worried about it, but I had no symptoms from it. I've also, when I do my yard with the weed eater, that position that I hold my weed eater would give me at times. I do that. I've been doing my yard every week and with no symptoms as well there. So I'm extremely happy. I'm not cured. I mean, my back obviously needs surgery, but at this time, I am completely happy, and I couldn't be more happy with the results of what happened with the PRP.
Yeah, and I think that's great to note out there is if you've had epidural injections in the past that have worn off after a month or 2 months, when I'm talking about epidural injections, I'm saying with steroids, you know, it's worth it to come here to Cancer Spine Center and try a PRP epidural. You know, a lot of people say the epidural hurts more or is a different type of procedure for you. Is there any difference between the steroid epidural and the PRP epidural, even that day or the week following, anything like that at all that you noticed?
I felt the steroid, it was painful. I would say 4 or 5 level. The PRP is definitely, it was more painful at the time of the injection. Yeah. Within a couple hours, the pain went away and I was feeling a lot better, but it was definitely a little different pain. But for the results that I got from it, I'll take that pain any day to get that shot to feel the way I feel now. So the pain's worth a few hours versus every other day or every other week I'm going through some type of spasm. Now 6 months I haven't had one spasm.
No, I think that's great. So to learn more about PRP, platelet-rich plasma, you can search it online, you can see it on our website, you can call us at 954-567-1332. But Curtis, thank you very much. It's great to see you well. Get out there to the softball field, hit some home runs, all right?
Let's do it. Thank you.
Man.